Corrective chiropractic adjustments for a straightened lumbar spine, or what you would call flat back syndrome. Most people with a straightened lumbar spine are told surgery is their only option. That's absolutely not true. But after over 30 years of helping thousands of people avoid the knife, I can tell you that's not the way to go in 99% of the cases. If you've been living with chronic back pain or leg pain, what you call sciatica, disc problems because of a straightened lumbar spine, also called flat back syndrome, this video could change everything, possibly even save your life. I'm going to show you the exact corrective chiropractic adjustments we use in this practice in Livonia, Michigan to restore the natural lumbar curve, eliminate pain fast, reduce disc pressure so you can stabilize your spine, get your life back without drugs or invasive procedures. Hi, I'm Dr. Gregory Kramer. I have over 30 years of clinical experience in advanced certification in chiropractic biophysics. Chiropractic biophysics is the premier structural rehabilitation technique in the world. It is a non-surgical technique to improve alignment. I specialize in treating chronic health problems. That means chronic neck problems, chronic back pain, L4, L5 disc bulges, sciatica, chronic knee problems, chronic neuropathy, and acute and chronic whiplash, and a host of other problems. And I use a variety of corrective methods, spinal decompression, and targeted, that means very specific exercises. Before I continue this video, I need you to hit that subscribe button if you want to learn how to eliminate pain, avoid surgery, stabilize your spine, so you can live stronger longer. All right, so some basic anatomy. We need a lordosis or curve in the lumbar spine. This is the belly, this is the buttocks, this is the sacrum, this is your tailbone or coccyx. Down here would be the top of your leg bones called your femur head. We need a curve, a lordosis in the spine. Somewhere around 40 degrees is ideal. Give or take, depending on your personalized anatomy, but give or take, it should have a normal curve. So that means some people normal could be 45, the other person normal could be 35. Everyone's a little different, but we're not saying 40 versus 0. No curve is no bueno, no good. Without a curve, we don't absorb shock. The pressure on the disc is abnormal, and as long as you live in a gravity-based environment on planet Earth, if you have abnormal alignment, you have abnormal weight bearing, abnormal load. And we all know buildings that are out of alignment break down faster. Car tires that are out of alignment break down faster. So we need a lordosis. When we lose that curve severely, we can call that a flat back syndrome. Now let's look at the opposite of normal. This person has no curve. They put a curve in, but what's all that white? Those are surgical screws. So that is an option. Now that is a horrific surgery. If you want to have plates halfway down your spine, that is a horrific surgery. So that is an option. I'm giving you a better option for 99.9% of you. And I can say that based on my experience and based on the research. My experience is over 200,000 visits over the last 30 years. We've helped people avoiding drugs and surgery using non-surgical methods, typically adjustments, exercise, traction. And we use a little acronym. And so exercise, mirror image, the opposite of your alignment, adjustments, and traction. And I'm going to show you today the adjustment portion. So we use the acronym EAT, exercise, adjustments, and traction. This would be a flat back. There's no curve. The belly's here, the buttocks is here. There's 5 lumbar vertebrae, 5, 4, 3, 2, 1. This is the sacrum for S. So over time, that puts abnormal load, abnormal strain. The muscles don't develop. If you have this when you're very young, the muscles don't develop correctly. So we want to put a curve in there. Now, like I said before, surgery is an option, and this is ideal what we want. So we want to use adjustments, exercise, and traction. These are non-surgical methods. And typically, in my experience, most people, to correct a lumbar spine, you're probably looking at somewhere between 3 and 6 months. And then you might need some maintenance afterwards. But if you are looking for a non-surgical solution, you want to look up someone that's certified and Chiropractic BioPhysics. You can go to idealspine.com. Idealspine.com, you will find a certified chiropractic biophysics practitioner in your area. Their clinic will look different, their training is different. What you probably see on the internet is manipulation, and manipulation does have value for short term. So when you see those quote crack videos, they have short-term pain relief, short-term increased range of motion, and short-term minimizing muscle spasm. But if you want long-term, you got to change alignment, and it requires more than a quote crack video. It requires pressure over time in the specific direction utilizing the EAT protocol. E stands for exercise, mirror image, A stands for mirror image adjustment, and T stands for traction, which is pressure over time. So this is the third part of what we need to do to increase the lumbar lordosis. Remember, when you don't have a proper curve, let's call it lordosis in the low back, that means you don't have a shock absorber. Can you imagine if you drove any vehicle without a shock absorber? There's going to be more trauma, more pain, more stress. So what we're trying to do is put a curve in when someone doesn't have the appropriate curve in their low back. So we talked about traction, we talked about exercise. Now this is what an adjustment would be. So visualize we are trying to induce a curve. So if there's no curve, we would induce the curve, and we would elevate the table or put in some type of cushion. I will show you on a spine model, then I'll show you on a patient. So we would put you in this position. This is an instrument. So this is a very low force but high frequency, and we would find the vertebrae that are locked. So we take motion x-rays of you bending forward, bending side, and the vertebrae that are stuck or frozen, we're going to use an instrument. So the person now is in a lordosis. We're putting them in a position to create a curve, and then we apply a force, and it's that simple. Now the other thing we might use is a drop table. So you're in a position, and then by holding you, we do a drop adjustment. Okay, so this is, again, the third part of how to correct for lumbar hypolordosis, not enough curve in the lumbar spine. Straight spine, hypolordosis, lordosis. Hypo, not enough curve, lordosis. So what we're trying to do is create a lumbar spine create a lordosis in the lumbar spine using adjustments, exercise, and traction. So one of the ways that we can do this is with a drop adjustment. I'm going to go ahead and press up on your... Now remember, we've already measured the x-ray. We've already tested the patient for tolerance and make sure it's comfortable. No adjustment, no exercise, no traction should be uncomfortable. Nothing should cause pain going down your legs. So now we are creating a lordosis, as you can see. Eye contact, the locked vertebrae. And there might be more than one locked vertebrae. And we determine the locked vertebrae from the motion x-ray. Now, we're also going to do a different type of adjustment. This is called a drop piece. So the drop piece makes a noise. I contact the vertebrae, and I thrust. Now, if I needed more lordosis, and if this helped relieve pain, I would create more, push up higher with the chest, a little bit less. Okay, if this was uncomfortable, we would do a little less, go down a little bit. So I can modify it. At the beginning, when someone's spine is stiff, we start very gentle, and then as time goes on, we can get a little bit more aggressive. And that is a drop piece trying to increase the lumbar lordosis using instrument and drop, and that's part of the three-part step or series to create lordosis: adjustments, exercise, and traction. A strained lumbar spine isn't just uncomfortable. It's a serious condition that will only get worse if you left untreated. Remember, poor alignment matters. A tire misaligned will wear out over time. The truth is, surgery can often be avoided, especially if we catch it early and apply the right corrective care. One of the most effective non-surgical approaches is chiropractic biophysics. It combines mirror image exercise, that's the E, mirror image adjustments, that's the A, and mirror image traction, which is the T, to help restore the natural curve, balance the load on the disc, eliminate pain, stabilize your spine, and protect the disc to prevent future bulges and herniations. Now, if you learned something new, hit the like button and share this with somebody you know that has back pain or back stiffness, leg pain, because they really need it. And share it with people that while they may be able to participate in physical activities like work or sports, but they feel beat up afterwards. That is the sign prior to you being disabled. Share this video with them. Also, if you learned something new, I want to hear what resonated with you. And if you want to keep learning how to eliminate pain, avoid surgery, and strengthen your spine, make sure to subscribe. Now, if you're ready to see the exact mirror image exercises that can help improve lordosis, watch this next video right here and start taking control of your spinal health today.